Hello, welcome to Holistically Speaking. I am your host, Morella DeVoe, and I'm very excited because today we're doing our very first live show. Today is Friday, June 28th, and it's 6 o'clock. So if you're watching us now, we are live, and we're going to invite you to call us in at the number right at the bottom of your screen, 802-651-0589. to ask questions. We are joined by Dr. Joshua Green, who's a naturopath, and we're delighted to have Dr. Green with us because he's here to answer your questions. I'm going to try to keep him entertained as long as I can, but what we really want is for you to call with any question you may have about your health. And I'll let Dr. Green introduce himself and tell us a little bit about his practice in a minute. But I always like to remind you all to email us and ask us your questions and send us your suggestions for shows. And that is holisticallyspeakingtv@gmail.com. But again, we're live and you can call us at 651-0589. So, Dr. Green, you're a naturopath. So, to get started, please tell us what is naturopathic medicine? What do you do?
Well, Morella, thanks for asking. Pleasure to be here. Thank you for the invite. So, naturopathic medicine, we are physicians of natural medicine. We're trained in conventional as well as natural medicine. So we use conventional as well as holistic diagnoses. Mm-hmm. We look at the whole person, very comprehensive visits. Yeah. And some parts are very similar to what most people have experienced at a medical doctor's office or osteopathic physician's office, and some aspects are very different. So, we go through health history, the history of present illness, and then we'll go through a review of symptoms, and go over the any medications and supplements they're taking, family history, past medical history, go through diets, ask them what they're eating, how do they feel after eating these foods. We'll do an exam, we'll explain the assessment of what we think is going on and why, and then make up a treatment plan. I think the biggest difference in what we offer is that we spend for an initial visit anywhere between 1.5 or 2 hours. I'm one of the rare naturopaths who spends 2 hours with almost all of my initial visits. And for me, that's just because I have a lot of questions and I want to understand how my patients live and how they operate, how they interact and react in their world. And that helps me really understand how to help them more. Right. And so, we've also been dubbed the doctors who listen. Yeah. And it's because we do our best to listen to our patients and not try to cram them into a 5 or 7 minute visit. And someone can have a naturopathic doctor as a primary care doctor, right? Yeah. Yep. For over half, maybe 2/3 of my patients, I'm their primary care physician. Oh, that's wonderful. Yeah, it's great. And the best part about that is, naturopathic physicians, I don't think many people know this, especially, I don't know if a lot of medical doctors know this, but we're trained, it's hammered into our brain, if this is outside of your expertise, refer. Right. So I think, I'm biased, I tend to think that more than any other, physician group, we refer. If it's not in our expertise, we refer out. Right. And so, we can talk to them about their diet and talk to them about their main concerns. And if it's something that needs further assessment, we'll refer to a specialist for that. Oh, wonderful. Yeah. And you also work with traditional labs, right? Like blood work labs, and you read them and you... Okay. Yeah, we do traditional labs. We also do non-traditional labs. And so, for instance, in cardiology, the typical labs just check HDL, LDL, total cholesterol. And we're finding that, the drivers for cardiovascular disease are not being tested. People are having heart attacks and they're getting a pat on the back, good job with your HDL being 75, and they have a heart attack the next day. Yeah. And so we're finding that, there are fractions of HDL and fractions of LDL that are good and bad. And so if we don't look at those fractions, then we don't actually know why those numbers are what they are.
Yeah.
So that's the other benefit of being a naturopath is that we look at these other specialties.
Wonderful.
Yeah.
So I want to remind our viewers again, if you're just joining us, that we're live Friday night, June 28th. I'm ahead of myself. And you can call us to ask your questions of Dr. Green. Our number is at the bottom, right at the bottom of our screen, 651-0589. So I'm going to go ahead and ask you some questions.
Great.
Given the season, I have a few questions as to what might people do, especially right now, there's been lots of allergies because of the pollen.
Yeah.
It's been almost like an unprecedented season for allergies. So what are some of the approaches that you or a naturopath might have or that people can look up?
Yeah, it's really fun. There's a lot of things that are very helpful for allergies. For some patients are more helpful than others. So, I would say the most important thing that I see for working with allergies is removing a food that the body can't digest properly, what we could call a food intolerance. Also working with food sensitivities, food allergies. I guess you could say cleaning up the diet. What happens in the body is that when we're eating foods that the body can't digest, it causes a subtle irritation and inflammation that makes the body more reactive to other things. The example I like to give to patients is, imagine someone who is having a disagreement in their house with a loved one, and then they go to the post office to send some mail, and then they go to the grocery store to pick something up, and they're a little irritated. They're like, a little bit irritable with people that they interact with.
Right.
Well, it's not those interactions that are the problem. It was the original disagreement. Yeah. So similar in the body, we're going to be reacting more to pollen or to soy sauce or these other things that should be innocuous.
Right.
And so when we deal with the initial problem, things are much better.
Right.
So that's the most important. That's the foundation work for the allergies. Yeah. Beyond that, homeopathy can work wonders. There's definitely some different homeopathic remedies that are very helpful. I think one that gets a lot of mileage, it's called arsenicum album. It's a very helpful remedy. Roost tox is another helpful remedy. And also the remedy, it's actually called histaminum. It's made from histamine. And that's also very helpful. Obviously with homeopathy, you want to match the remedy correctly. It's a very individual decision. Also, as far as food and supplements go, honey for some people is helpful, especially if it's local.
Local raw.
Yep. Yeah, local raw honey. Yep. And not just to support your local friends and farmers, but also because it's that pollen that you're reacting to that will be in the honey. So you want to get local, seasonal, raw. So if it's in the springtime, you want to have spring honey.
Right.
Other than that, also bee pollen can be very helpful because it's a much more concentrated dose. And for some people notice that the amount of pollen in the honey isn't enough to really help their body kind of calm down. So when we eat something as food, the body ideally will ramp down the immune system and say, oh, this is food, we're not supposed to react to it.
Right.
Ideally speaking.
Yeah.
And so that can help with the allergies if we're eating that pollen.
Yeah, and educate the immune system. You know
Exactly.
what I've also found helpful in my own kind of progression out of my chronic allergies was rebuilding my intestinal flora.
Definitely.
Probiotics, fermented foods, and all of that. It's like, once that was stronger, I was reacting less to things. And so I often suggest that to people as well. Have you noticed that?
Yeah, it's a great suggestion. 90% of our immune system is in our gut, in our GI tract. And so, using some really good, high-quality probiotics dosed,
Yeah.
correctly, does wonders.
Yeah. Wonderful. Well, thank you.
Sure.
So again, to our viewers, if you're just joining us, we are live with Dr. Joshua Green. And you can call us at the number at the bottom of your screen, 651-0589, with any question you may have. And we were talking about, this is not about diagnosing, right? You're not diagnosing anybody.
Not diagnosing.
These are just suggestions that things people might look up or even talk to their doctor about. So the next one on my list are, I guess it's kind of similar, skin hives.
Yeah.
Is there anything different that you might do for a skin condition?
Yeah. So yeah, similarly, you want to treat the cause. You want to working with the foundation, and so removing those foods that the body can't digest, increasing probiotics, very helpful. For hives, the pollen probably won't be as helpful.
Right.
A great homeopathic remedy that helps with a lot of hives, although again, you want to get the individual remedy that matches, but apis is a really helpful remedy for hives in general.
And is that topical, or is it like a pellet?
Usually internal. It's these little white sugar pellets, and the remedy is actually coated on the outside of it. Which is why if you give it to children, if it just touches the inside of their mouth and they spit it out, it's done its work. For adults, we tend to need a little bit more support, so we actually need to let it sit under our tongue until it dissolves.
Yeah.
So yeah, apis is a great remedy. I just actually just had a patient recently with chronic hives of 5 years.
Oh my gosh.
And this particular patient is doing much better with a remedy called lachesis, which is made from a snake, actually, Amazonian snake. Yeah. There's no actual parts of the snake there, but and it's been really helping her, which has been awesome.
Nice.
Because 5 years of chronic hives will, drive you batty.
Yeah. As we're on the topic of homeopathic remedies, and I just said topically, I have to say my favorite, maybe it's because I've been falling a lot lately and snowboarding and working out. I've had a lot of bruises, and then hiking a couple weeks ago, and Arnica.
Yeah.
Unbelievable. Yeah. Rubbing Arnica on your and I have the pellets. I now have them with me all the time, so it's like, rub on the Arnica. And what else? Is it mostly bruise? Oh, we have a caller. Yay.
Excellent.
So we'll hold that thought. Hello, welcome to Holistically Speaking.
Thank you.
So you have a question for Dr. Green?
Yeah, I'm wondering what sort of natural remedies I can employ to help with tree pollen allergies.
Oh, wonderful. So you just joined us. We talked about that a couple minutes ago, but I'm sure that we can
happy to rehash
recap
that
again.
So in general, just as a medical disclaimer, so I don't get a call from the Vermont Board of Health, I can't diagnose or treat individual conditions, but I'm happy to give general advice for tree pollen allergens in general for the public, if that's okay.
Sure.
Okay. So in general, for people who have tree pollen allergies, having some bee pollen can be helpful. Having some local seasonal honey is helpful. Removing any foods that don't seem to digest well. Focusing on more, what we could call alkalinizing foods like green leafy vegetables and beans. Staying away from more kind of grain-fed meats. If you're going to have meat, have it be more, grass-fed and local. Keeping that inflammatory response down can be very helpful.
Okay. Now, my friends have told me that perhaps if I quit smoking, my allergies wouldn't be so bad. Are there any natural remedies to help me quit smoking?
I can help you with hypnosis, but
there are lots of remedies. Again, in general, for people to quit smoking that are helpful. There's a great herb that does wonders, and that is Avena sativa. It's made from the milky oat tops. And what it does is it's a nutritive nervine, so it helps to calm the nerves, but also helps them heal. So cigarettes are very addictive, and by some people's comments, it's the most addictive drug out there because it activates the sympathetic and the parasympathetic nervous system. So it's both sides of the coin when you're resting and when you're being active. So a lot of drugs are just one or the other. So that can be helpful. So oats can be helpful. Also, there's another great remedy called Nux vomica that helps people in general who have, want to stop smoking.
Oh, and that's also a homeopathic pellet?
That would be a homeopathic pellet. The Avena sativa, that's more in a tincture form or a glycerite form.
Wonderful. Thank you so much.
Yeah, my pleasure. It's a fun topic.
All right, well, have a great day.
Thank you for calling.
Oh, and before you go, it's always a great day to quit smoking.
That's true.
Thank you for calling.
Okay, bye-bye.
Bye.
So, I teach part-time at the community college, and I would talk almost every day to my students about what a great day it was to quit smoking.
Yeah.
And so sometimes after like the first 4 weeks, I would stop and I would come in and they'd say, Dr. Green. I was like, yeah, like, today's a great day to quit smoking. It was really fun.
That's wonderful.
Yeah.
So a question about the bee pollen and the raw honey, because I often get this question too, is how much and how often? Daily, a teaspoon, a tablespoon, less? What would you typically say?
That's a good question. I think for the honey, you would want to go like a tablespoon. For the bee pollen, a teaspoon, and even that is a lot. I mean, I don't know if you've ever tried bee pollen. It's intense. If you are a super taster, it's going to be intense for you. But yeah, I'd say a teaspoon for that.
You know what I did when I was working on my allergies and I was taking bee pollen is I would do like a quarter of a teaspoon in my smoothies. So I would put that in my smoothies.
Yep, and have something in there that kind of masks the flavor.
Yeah, because it is an intense flavor.
Yeah, maybe some almond butter would be helpful.
Yeah, exactly. So again, if you're just joining us, we are live Friday night with Dr. Joshua Green, who's a naturopath, answering your questions, and you can call us at 651-0589. We were talking about
Arnica.
Arnica.
Yeah.
So what can we use Arnica for? Is it just for bruises, or?
It has a lot of uses.
I guess we're not going to talk about Arnica. Hello, welcome to Holistically Speaking.
Yes, my name's Daryl.
Hello, welcome. And you have a question for Dr. Green?
Yes, I'd like to ask if he could comment, does he know anything about oil of oregano?
Certainly.
Yeah, it's a great medicine. Lots of uses. Are there any particular questions you have on it?
Well, only that I've been using it, and my wife's a little skeptical, and I just wanted to get your opinion. I think I feel good, and I'm not sure exactly what it's doing, but I've kind of gotten used to taking it. I do 4 drops every morning under my tongue, and I don't think it's
that would burn a little bit.
Hurting me, but I just wanted to check and see what your opinion of the item is.
Yeah, well, the first question I want to ask is what got you to take it? What interested you in taking it?
Yeah, my sister mentioned to me that she had heard something about it, and I just trust her, and so I went after it.
Great. And are you taking it for any particular reason?
Why did I start taking it?
If it's too personal, you don't have to say it.
I took it for my gums.
Okay. Yep. Excellent.
And I feel like it's helping. I've got a little bit of a gum situation, and I think
it's helping.
I just went to the dentist recently, and they said my gums were not deteriorating with any progress. So I kind of feel like the oil of oregano is helping me.
That sounds like something you should continue doing then. That's
great. Good.
Yeah,
appreciate it.
And oil of oregano is...
And would you do one more thing?
Yes.
Would you spell those 2 items that you mentioned for quitting smoking? I'm not smoking, but someone in the family is, and I'd like to suggest where I would get it.
Yeah, the first one is Avena, Avena, second word of that is sativa, S-A-T-I-V-A. And you could probably get that at any natural food store, so natural food store or vitamin shop. So probably City Market, Healthy Living, or the Vitamin Shop.
Yeah.
I'm thinking.
And the second one was?
Oh, also Purple Shutter, that cute little shop in Winooski.
Yep.
Would probably have it. And the other one is a homeopathic remedy called Nux Vomica. And that you could get also either at the Co-op at City Market or at Healthy Living.
And that's
Can you spell that?
N-U-X?
Oh, yes. Yeah, N-U-X. And then the second word is Vomica, V-O-M-I-C-A.
Thank you.
Oh, I really appreciate it. Thank you very much.
Oh,
Enjoying your show.
I'm very glad to hear that.
Thank you. Thank you for calling.
Yes, ma'am. Bye-bye.
Bye. And so, oil of oregano.
Yeah.
I was surprised that he said that he takes 4 drops under the tongue because it really burns. It's quite potent.
Yes, it would definitely burn.
Yeah, and tell us about some of the properties that you know oil of oregano to have.
So, it'll have some antifungal, antibacterial properties. In so doing, it'll also have some carminative properties. It'll help decrease some gas because a lot of that overgrowth will be causing gas and distension in the belly.
Yeah.
For the mouth, it would be great for a rinse. Very antimicrobial, antibacterial.
Another thing that has been gaining popularity in kind of the natural health world is oil pulling, like doing oil
swishing, oil pulling.
Oil swishing.
Yeah.
What do you recommend for oil pulling?
People tend to like it. I think most folks I've talked to seem to do the sesame oil, although I'm trying to think the other popular one, there's sesame oil and coconut oil.
I do coconut oil.
Yeah.
I love coconut oil. I mean, it's tastier too.
I think it'd be more enjoyable.
Yeah.
I don't know which one would be more efficacious, but I think the coconut oil would be more, compliance would probably be better.
Yeah, for sure. And what's interesting is that I've heard reports of people's gum health improving with oil pulling and whitening, removal of stains with oil pulling. And it's just kind of this new thing that we're kind of, people maybe were doing a long time, but we hadn't heard about it so much here in the U.S.
Possibly a resurgence.
Yeah.
There's another great book on that same kind of vein. I think it's called Kiss Your Dentist Goodbye.
Nice.
And written by a dentist, kind of more holistically minded, who was really focused on creating a proper pH of the mouth.
Nice.
And talking about how we need to, there's a certain stepwise order to keep the pH strong, so to kill off the microbes and then to replenish the pH. And the key at the end is using xylitol. Xylitol to rebalance that pH because it's very alkalinizing.
Interesting.
Yeah.
So once again, we have about another 6 minutes or so. We are live Friday night with Dr. Joshua Green, and you can call us with your questions at 651-0589. So maybe we need to start talking about Arnica.
I was just thinking, yeah. Arnica, a lot of great uses. And so most people use it for, falls, traumas, injuries. It's also, I used it, I ran my first marathon this year.
Oh, wow.
And my dad, who's actually here today, ran 10 of them, and I was, thought I would just do at least one,
Wow, yeah.
And he's happy because I didn't beat his time anywhere close. So his records are intact. And I use Arnica to help recover from the marathons.
Oh,
and
nice.
Amazing job helping with that. I also used some Mag-Phos to help the muscles relax. Arnica is great for that. It's also, there's the guy who owns Hahnemann Labs in California. I'm trying to think of his name, homeopath. He's actually, I think, he is a pharmacist who does homeopathy solely, I think. Michael something. Anyways, he has taken Arnica in very specific doses and very specific regimens, and he did a trial with plastic surgeons, and he found marked significant healing time and decrease in scars using the Arnica.
Oh my goodness.
So
wow.
yeah, he took this remedy that, I mean, maybe the actual cost of it is, maybe like 2% of what now these plastic surgeons are selling it for. But the results are amazing. So yeah,
Wonderful.
before and after surgery, I've had multiple patients take Arnica. I've given them Arnica before like hip surgery, and it tends to help decrease the amount of narcotics they need for pain relief, and increase the healing time. And although it's always kind of hard to know exactly if it's better or not because you're gauging it against their last surgery, and they're very different situations, but it tends to be very helpful.
Cool. So let's see. I have a few more things that we can get to. How about sunburn? If people, kind of if we do start getting some sun this summer, hopefully, sunburns. Do you have kind of natural treatments for sunburns?
Yeah. Well, yeah. One, of course, it's a welcome problem because it means we're getting sunshine.
Right.
And being in Vermont, our vitamin D levels, it's it's rare that I find a patient with normal vitamin D levels.
Yeah.
And who also it's rare that doesn't benefit from vitamin D supplementation. But yeah, regarding the sunburns, definitely making sure that we're hydrated enough is very important. Most of us are actually chronically somewhat dehydrated. Yeah. Not to the point that we need to go to a hospital, but yeah, walking the talk. Yeah.
Right.
So hydration is very important.
Yeah.
The other thing that doesn't get talked about enough, really, I think, is that the two main pigments that help us keep to not get sunburned. Most of us know the one is melanin. Right. But the second, do you know this one? No. It's really exciting. Beta-carotene.
Oh, yes.
Yeah, beta-carotene. So this is, in the body, we have and need tons of beta-carotene. Yeah. And so beta-carotene foods, so, all season long, all year round, every season we have great access. We have squash and pumpkins and
carrots.
Carrots. We avocados are actually high in beta carotene. If you
it's incredible how sun protective it is. The more that you eat these foods, you can tan without burning. When I started experimenting with that, I was floored.
Yeah.
Unbelievable, because I was always like a red burner. It's like, oh my gosh, I could get a tan. Right. When your beta carotene levels are up.
Yeah, and you don't need to look like the juice man. You don't need to have 30, 40 carrots a day. Even just 5 to 10 would make a huge difference.
But when the other thing that I've tried when I have gone a little further than I should have and I have a little burn is natural aloe vera. So I always get the aloe vera leaf and I cut it up and I just rub it on my skin. Yeah. Aloe vera is incredible for skin healing.
Yep. After once you do get the burn, aloe vera is great. What I found helpful is making sure that the skin is moisturized or hydrated first. So external and internal water, and then you put the aloe vera on after. And then it really just kind of brings that moisture in.
Right.
Homeopathically, belladonna can work really well. Apis can as well.
That's my timer saying that we're almost out of time.
Oh, that's nice to have.
But I know you have an event tomorrow. You have an open house?
Yep, we're having an open house.
Feeding people?
Yep, feeding people. We have live music. Craig Myers of Barica is playing his Ngone.
Oh, nice.
Yeah, and we'll have food and drinks, art show. Jordan Douglas is showing his art. From 2 to 6 p.m. at 13 Kilburn Street.
13 Kilburn Street, 2 to 6 p.m. on Saturday,
June 29th.
29th.
Yeah.
Excellent. Well, we're out of time, so thank you so much for joining us.
Thank you so much.
It was lovely having you. It was a lot of fun.
I had a great time.
Thank you for joining us as well.
Flew by.